Governor, Lieutenant Governor, Dr. Bittinger, Reverend Walker. Welcome. Good afternoon, everyone. I'm going to provide some additional detail on the vaccine process and preparedness of our healthcare providers. As the Governor indicated, based on the prioritization, the initial limited availability of the Pfizer vaccine, the allocation of these first doses will be for hospitals. The distribution plan focuses on hospital capacity to store and administer the Pfizer vaccine for the healthcare workers in COVID-facing work, including dietary and environmental service workers, while achieving geographic equity. Hospitals will either receive the vaccine directly from Pfizer, will receive from larger hospitals, or will, with more storage capacity, or from the Department of Public Health directly. So, in fact, across Massachusetts, 75 of the 77 hospitals will receive the first vaccines. The hospitals selected that who will directly receive their first doses directly from Pfizer are those who have access to ultra-cold freezer storage, the ability to maintain the vaccines at minus 70 degrees Celsius. They've indicated they have the capacity and staffing to administer at least 975 doses, which is the minimum allotment of vaccine within 2 weeks, and they can serve each of the regions across the Commonwealth. Smaller hospitals will receive allocations from the larger hospital systems within their healthcare networks, or they will receive them, as I said, from the Department of Public Health, as we will receive vaccines straight to our cold storage. Every hospital, as I said, but two, have been linked to ensure that they have access to this first allocation of vaccines. Hospitals will receive the initial allocations, that are receiving the initial allocations will expect an email notification from the Department of Public Health today, and additional notifications and outreach obviously are forthcoming as we receive more information from our federal partners. Hospital providers are pretty ready, and they've been taking the following steps, but I'm here to remind them on how to prepare for the receipt and administration of the COVID-19 vaccine. One, they're reviewing the Massachusetts COVID vaccine program guidance for hospitals issued by the Department of Public Health. Confirming the lead person at their hospital for COVID-19 vaccine information and planning and implementation. Confirming that their hospital has been fully registered and onboarded to submit the vaccine administered data to the Massachusetts Immunization Information System, which is our source of truth. And reviewing their facility's current emergency vaccination plans and updating them if needed. But as I said, our hospitals are ready. As Massachusetts receives additional quantities of both the Pfizer and Moderna vaccines in the coming weeks, the list of our provider sites will obviously greatly expand. All vaccinating providers will be receiving guidance about training, storage, handling of vaccines, and the timing of receipt of their doses. Where to get vaccinated? When available, all healthcare institutions, including our hospitals, community health centers, private medical offices, will have access to the COVID-19 vaccine for their patients. Many medical professionals can administer the vaccines. Doctors, nurses, dentists, other licensed clinicians, pharmacists, pharmacy interns, pharmacy techs, paramedics, and certified medical assistants under supervision. Individuals living and working in long-term care will be vaccinated as part of the Federal Pharmacy Partnership Program. The federal government has partnered with CVS and Walgreens directly to go out to long-term care facilities to vaccinate staff and residents. And again, as the governor said, we have set up a website, mass.gov/COVID vaccine, for more information. And that will be updated, obviously, as more information comes in. And with that, it's my privilege to turn the microphone and the podium over to Dr. Paul Bittinger, who, as I'm sure many of you know, he holds the MGH Endowed Chair in Emergency Preparedness and is the Director of the Center for Disaster Medicine at Mass General Hospital and serves on the Governor's Medical Advisory Board, and we asked him to chair the Vaccine Advisory Board as well. Dr. Bittinger.
Good afternoon. I would like to start by thanking Governor Baker, Lieutenant Governor Polito, Secretary Sudders for the opportunity to work with such an extraordinary group of accomplished experts and individuals on the Vaccine Advisory Group. I would like to specifically thank all of the advisory group members, including Reverend Walker, for hours and hours and hours of thoughtful discussion over many weeks in the recent past. They have been extraordinarily thoughtful in their deliberations about how to best administer vaccines against COVID-19 and how to best and most equitably protect life and health in the Commonwealth. As the advisory group discussed the anticipated vaccinations, we spent a lot of time talking in detail about how we and the residents of the Commonwealth will be assured of the safety and efficacy of the vaccines that become available. The group specifically noted that the bar for approval of vaccines is the highest for any of the therapeutics that come through our regulatory system. Vaccines are administered to healthy people and therefore must have the highest safety profile in order to be approved or receive an emergency use authorization. The system that supports that is extraordinary, and while the pace of development of these vaccines has been unprecedented, what the group also really focused on is how much is normal about the process of approval of these vaccines with respect to assuring their safety and efficacy, and really are the same on the safety side as they have been for vaccines that have been approved over the last 2 decades and longer. We noted that all of the clinical trials that are conducted have had to set out previous standards before any patients are vaccinated about what the bar is for safety and efficacy that they must meet. During each trial, an independent data safety monitoring board, independent group of experts, separate from the study, separate from the government, reviews the data and puts their stamp on the safety of the vaccine as the trials continue and as they complete. In addition, following every trial of a vaccine, the data must be independently reviewed by an expert board that advises the FDA, called a Vaccine and Related Biologic Projects Advisory Committee, and that committee will be meeting tomorrow to review the data from the Pfizer vaccine. In addition, there is yet another independent layer of experts, separate from the government, separate from the trial leads, called the Advisory Committee on Immunization Practice that is convened by the CDC, who also must give their stamp on the safety of the vaccine. And our group really takes confidence in this multi-layered approach by extraordinary experts who are independent in the evaluation of both safety and efficacy of the vaccine. I would also say that there's been so much that's been extraordinary in the scientific progress in responding to this pandemic, including the scrutiny of all data of clinical trials, of therapeutic interventions, of others that has been unprecedented. Things come out and within a day are evaluated by multiple experts around the country, around the world, and the same will very much be true for vaccinations. That as the data is being released now on each of the vaccines that is under evaluation for emergency use authorization, multiple professional societies, healthcare systems, infectious disease experts, immunologists are poring over this data to make sure that they can add their stamp of approval and confidence in the safety of the vaccine. And none of us will do so without our confidence, because we all share the same goal of preventing harm, saving lives, and conquering this pandemic. So because of these multiple layers of independent evaluation, because of our confidence in our expert colleagues, and frankly, as was mentioned by the Secretary, because we are so blessed with such extraordinary leaders and experts in this Commonwealth, we feel we're in a very good position to have confidence in the safety and efficacy of the vaccine. And I would like, again, to thank the advisory board for their, group, for their thoughts and for their input. And we continue to try and help and serve the Commonwealth in every way we can. I'll turn it over to Reverend Walker,
Thank you very much, Governor, Lieutenant Governor, Secretary Sudders, and Dr. Bittinger. It is an honor and a humbling honor to be a part of this esteemed effort. It is a piece of history. I accepted the invitation to join the COVID-19 Vaccine Advisory Group so that I could learn as much as I could about the process of distributing the vaccine to take back to my community. I work specifically with a group of people who have been traumatized by violence, by racism, by systems, by history, and so they suffer disproportionately anyway to the added complexity of this pandemic. It was an honor to work with this esteemed and dedicated group of medical, infectious disease, and public health experts. I found this group to be thoughtful and incredibly committed to getting this right and being fair. This was complex and difficult work. Everybody rolled up their sleeves, put in the time, and did what was necessary. Communities of color and at-risk populations will be prioritized throughout this process in order to preserve life and prevent serious complications from COVID-related illnesses. We want to engage our communities and build on long-standing relationships to ensure access. In phase 2 of the distribution, a 20% increase in vaccine will be allocated to communities that have experienced a disproportionate COVID-19 burden and high social vulnerability, as measured by the CDC's Social Vulnerability Index, which includes socioeconomic status, household composition, minority status, and language, housing, and transportation. They'll be equally weighted between those two. If I had to preach on this experience, it would be called Imago Dei, in the image of God, because more than anything, this group that I belong to worked hard to affirm the ultimate value of life, of every life. We are all aware of the troublesome trust factor in our country and in many communities. We know that trust cannot be earned in one news conference or in one statement, but we are all committed to the work of engaging residents and community leaders in as many ways as we can to be a part of this effort. In Zoom forums, on one-on-one, in any way we can to help people make informed decisions. My prayer is that I have earned enough trust in my own community to help people make good decisions. Thank you very much.